Welcome to Hump Day Hormones. Today, we are going to meet the newest member of the Hump Day Hormones team and learn who she is and why we added another women's health expert. Welcome to Hump Day Hormones. I am Dr. Jill Jennings, a board-certified OBGYN and Menopause Society certified practitioner.
And I'm Courtney Spann, a nurse practitioner. We work at the Women's Clinic in Little Rock, Arkansas, on the campus of Baptist Health. We are here to talk about all things female hormone related, from puberty to menopause and everything in between. We are here to inform you from a medical point of view about the latest scientific evidence in the world of hormones.
You can find us on social media, Facebook and Instagram, as well as YouTube as Hump Day Hormones. And you can email us your questions or topics for the show at humpdayhormones@gmail.com. We just wanted to have a quick little disclaimer that everything we talk about here is for informational and supportive purposes only, and this is not medical advice, as we are not your provider. Your body is unique, and so be sure to chat with your healthcare provider before making any changes to your healthcare routine. Welcome back to Hump Day Hormones. Today's episode is a little different because we're introducing somebody that we are so excited to have on our team. So this is not going to be like a rundown of scientific studies. I mean, maybe Amy knows them off the top of her head. I don't know. But this is not going to be some rundown of like science stats or anything like that. This is going to be fun, just kind of getting to know Amy. So if you've been listening for a while, you know our mission has always been to help women feel heard and educated and empowered through every stage of life. And so we've just grown so much. I mean, this started with just me trying to cram it into my already busy OBGYN practice. And then I got Courtney. And now we've grown so much that we needed another person, which is so amazing. But we have Amy here with us today, and she shares the same passion. She's been doing hormones for a while. But she brings years of experience. She has been at the Urogynecology clinic for about 8 years, and she is a certified menopause practitioner as well. So we thought the best way to introduce her was just to let y'all hear from her directly. So we're just going to let her kind of answer some questions and talk to you. So this is Amy Wilson.
Hi. So glad to be here. I feel very blessed to have found a good place to be. So, since our clinic closed. So a little bit about me, I guess. I grew up in Prescott, Arkansas. Married my high school sweetheart, and this year's going to be 29 years.
Oh my!
So that's kind of hard to believe. We have 2 daughters together, and then I have 2 stepkids and 5 grandchildren.
Oh wow!
So busy. And then I went to the University of Arkansas at Fayetteville. Got a chemistry degree there first, and then decided to go back to nursing school. So got a second bachelor's degree, and then a master's in women's health. So nice. I've been doing women's health my whole career. So.
Where is Prescott? I feel like I hear that all the time, but I don't.
Yeah. About 15 miles from Hope, if you know where Hope is.
Okay.
So just right off of I-30.
Okay.
Here, so
I was putting it up by Jonesboro, so I'm glad
we were talking about it, and I was like, oh, that's where like my husband has some deer
like
yes.
There's a lot of hunting down there.
Sure. Space. Yeah.
How big is Prescott?
It's about 4,000, maybe a little less than that.
Okay.
Yeah. Everyone asks a doctor there.
He's a doctor. Yeah, he does family prayers. Yeah. For 50 years. My mom was pregnant with me when they moved down there. So.
Oh my gosh, I love that.
He's still practicing?
He is. Yeah. His dream was to be a country doctor, so that's what he does. So.
Done.
Check that.
Makes house calls still, stuff like that. So.
Does he really?
Yeah.
That's amazing.
I feel like he's kind of my mentor for sure, that I kind of want to be like him of, not in it for money or anything. He just is all about taking care of people.
Yeah. Well, that's wonderful.
Yeah. So he's a good example for sure.
Yeah. So where have you what's your career been like?
So I started off at UAMS on labor and delivery. So I did that for about 8 years. After I had my second daughter, I decided that was too much. So I taught at the College of Nursing for a little while. And then one of the residents that I worked with was moving to Arkadelphia to open a practice. So I went down there with him because that's about 30 miles from Prescott. So my family's always been so important. So just being close to them. And so I was there for about 10 years, just in a regular OBGYN clinic. And then that clinic also kind of went out of business. And so then I was looking for somewhere and actually had the opportunity to work with my best friend for a long time at the Urogynecology clinic. So that's kind of how I went there. And then now I found y'all.
So you've been like women's health right out of the gate.
Yes.
Yeah.
So, yeah, I tried to do family practice actually for a little bit because I had thought about going back and working with my dad. But that just wasn't where my heart was. I was in my peds rotation when I thought this is not really for me. And so I called the women's health director, and she said, yeah, we'd love to have a spot for you. So moved on back over to my love. So it's, women's health has just always kind of been in my heart.
I bet you saw all the things at UAMS too.
Oh, for sure.
Yeah. Every there.
Definitely. All the things that they would say was 1 in a million, we would have like 2 or 3.
You would see it all.
I was like, gosh, we're never supposed to see this. And it was,
right.
It was very
like
meaningful for sure. It was, you being able to take care of women in some of the best times of their lives, and then sometimes the hardest time in their lives. It feels like a good, like you're just doing something good for people.
Yes. Labor and delivery is wild. It's either just like so routine. And I mean, you have to remind yourself that most of the time, it's fine. It goes routine. Babies come out fine. Moms are fine. But then, it just takes that one patient, and then you're like, for the next couple months, kind of stuck on that. So it is a wild time. So, and then you were with the urogynecology girls for like 8 years. Yeah. And then that clinic just completely broke up, right? Someone moved to St. Louis and someone went back to AMS. Yeah.
So we kind of all split up. It was really hard.
I know. And I love that you came from that urogynecology perspective, because that's the one thing that I don't know. I just feel like I've never really buddied up to urogynecology. I was so OB heavy, and I loved GYN and GYN surgery, but something about urogyn just never really made me that excited. And I feel like when I was in residency, we had fellows. And so the fellows kind of did most of our urogyn stuff. And so, I don't know. And it's just so like kind of different from person to person. And then prolapse surgeries are hard, and then they don't have a great success rate. Right. So that was always made that hard for me. But I love that you kind of bring that knowledge in, because it's honestly probably a little gap that I have.
Glad to bring that.
Yeah. So what are your, where have you kind of been with, when did you become menopause certified, or what's been your menopause certification journey?
So that was in 2022 that I got that certification. So,
okay.
Just again, kind of working with who have prolapse and the vaginal atrophy and all of that, and kind of working through all of that. And then hormones have such an impact on our, fascial tissue, all of that stuff. So, kind of ties in together. Mm-hmm. And just kind of working through all of the things going on with prolapse and pelvic pain and all of that just kind of led me into the hormone world for sure. So, and I think just, again, kind of those women that you feel like you're ignored. It was so good to feel like I could listen to people and help them through something that kind of, they were like, well, this is just part of aging. You're just getting old, and this is how you have to feel, to be able to help those women feel like they were heard and to help them through that transition and everything.
What are some of the biggest frustrations that you hear from patients?
I think that, again, we're just no one listens to them. They just kind of say that you're just a girl. And then I think lately it's been just the availability of hormones and, shortages and things like that it's just really hard for women to get the care that they need. It's like compounded medicines.
Finally, we started listening, and now Big Pharma can't catch up.
Mm-hmm. Yes. So frustrating.
What surprised you, and you probably just kind of answered this too, what surprised you the most when you started treating menopause?
Gosh, again, I think it is just the fear that women had from those older studies, and their practitioners still kind of going by that they're kind of fear mongering. I hate to say it like that, but everyone was so afraid of them when there's so much data that shows how safe they are. So kind of all the other practitioners trying to catch up to where we are.
Yeah. Do you feel like that your dad was pretty on it, or do you feel like you've had to have conversations with your dad about?
I think for the most part, he was pretty on it. My mom was on hormones, so
okay.
He knew, he understood, like, okay. And I feel a little guilty about it that I would ask her, did you take your hormones this morning?
Yeah.
So I feel like, he having experienced it with his own wife, I think he felt.
So he was never like in that fearful world of like everybody throw your hormones away.
So.
It's really weird because it's like this certain niche generation of doctors, I feel like, that were like that. Like my generation, so I graduated med school in 2007 and residency in 2011. My generation, I don't feel like is scared of hormones. We were all kind of like not taught a lot about them. But then I feel like we're all young enough when the Women's Health Initiative started getting walked back that we were like kind of fresh into our practice and sort of like still really eager to read and learn all the things. And then there's this generation, probably like your dad, that's been in practice forever, like back when, like Dr. Cope, like back when hormones were given to every single person and they were so beneficial, and they saw, how good they were for everybody. And they're like, all of our patients aren't getting cancer. Like what? Like, why are we throwing all these hormones away? And then there's I feel like this kind of generation maybe in the middle that still don't know about hormones.
Mm-hmm.
It's like they weren't taught about them. They were probably scared to death of them. And then they were a little too old when things started getting walked back to like probably care about figuring it out.
Yeah.
I just feel like there's this gap.
Well, and they had like probably the same kind of spiel that was kind of working for their patients.
Yeah.
Quote unquote working. They were like, well, we're not going to try to change anything at this point. Like,
well, because sometimes it is a big conversation. Like, I don't know if y'all hear that, but you probably hear this all the time in Urogyn world. Like women are like, I may not be on myself a little bit, but that's just normal. And you're like, I mean, do I just like smile and nod and go on and get this visit over with? Mm-hmm. And then she's out the door, but still peeing on herself. Or do I stop and say like, actually, that's not normal. Let's talk about this. And then open up this kind of 15-minute conversation. And so I feel like it is a lot easier. That's just one example, but with everything in hormone world, it's a lot easier to be like, oh yeah, no, I get that you're scared of breast cancer. Okay. And then just end the visit.
See you next year.
Yeah. Rather than like, hey, did you know that we know new things now? And let's talk about all the benefits of that. And I mean, I feel like the vast majority of the time patients are like, wait, what?
Yeah.
Like I had no idea that I could decrease my risk for heart disease. Like nobody talked about that. And I just figured my hot flashes weren't that bad. And, so I do feel like it takes more time, but
gotta take the time.
Yeah. Gotta take the time. It is so worth it in the end. And then you're like, it's not fair. Also, it's like, that people don't know that. I don't feel like it's fair just to let them live in their blissful ignorance.
Mm-hmm.
I mean,
Yeah. Or even just like bone health, we've really so many women who suffer from a fracture that we maybe could have prevented. And so I feel like that's reteaching women that like it's safe. There's all these other benefits. And we don't have to worry as much about cancer as we once thought.
That's right. Yeah, that brings to the next question. What's one thing you wish everybody knew about hormones?
Oh gosh. Well, I would say that they don't cause cancer.
Yeah. Yes. That's the thing. Yeah.
Everything has risks. I think we can't just like throw it at everyone, but I think we have to individualize it and make those decisions based on knowledge, not just fear.
Yeah. Yeah. And then this is kind of what we were talking about a second ago with the like, I mean, I'll just be on myself a little bit, but what is the symptom that patients just assume is like, well, this is just aging. This is just it. I've got to deal with it.
I feel like that is one of the major ones for sure.
Yeah.
It's like the frequency and the leakage and the brain fog, even just like everything's part of aging. But it's like, well, some of these things we can kind of help to treat and manage. And
I feel like in that Urogyn world too, like pain,
Prolapse,
sex, and like stuff like that. I mean, I hear women say that all the time. I'm like, I mean, it hurts, but like whatever. And I'm like, no. Like it's not supposed to hurt.
Right.
Yeah.
Or like their drive is down so
Yes.
much just because they have they never think about sex.
Right. Right.
Yeah. And maybe it hurts. And you're
And
not.
no one wants to do anything if it hurts.
Right. Right. So maybe, we should just probably back this up a little bit because I'm saying I don't love it as much as I love everything else. And this is where you came from and all this about urogynecology. But just like, what is urogynecology?
So they are specially trained in pelvic floor disorders, so pelvic organ prolapse, urinary and fecal incontinence, and pelvic pain. So to be a urogynecologist, usually you can do it through either urology or gynecology, and then they specialize kind of in all of those pelvic floor disorders, typically through a fellowship training.
Yeah.
And then as a nurse practitioner, they just kind of trained me.
Yeah.
So there's not any special training, sadly, for.
It's quite a big training, like in residency. Like, I mean, you would go through an OBGYN residency, so 4 years, and then do 3 more years of just urogynecology. And so, I mean, that's quite a lot more training, as a fellowship out of OBGYN. So, there is a lot of stuff that they get that obviously they can't cram into the first 4 years. I mean, yeah. So, lots of stuff falls under y'all's realm. And I know we had the pelvic floor physical therapist on with us a couple times, and they always said, like, how much urinary leakage is normal? And it was like this big deal of like, none, because everybody assumes like, well, just a little trickle is fine,
I mean, I feel like we always tell people, like, how much does it bother you? Like, if you really aren't bothered too much by it, I feel like it's okay. But we don't want to just ignore it and say, well, this is just part of being old. If it bothers you at all, then that's when we want to be addressing it, and how aggressive we are potentially depends on how much it bothers you. So, treating vaginal atrophy, physical therapy, for sure. We refer to everybody to pelvic floor physical therapy. There's pessary devices. There's things over the counter that are available too to try to help with leakage. Little devices that you can use, and then, just our skin care and all of that goes into it. There's a huge market for pads, but, I feel like which I think is why a lot of women think it's normal, is because there are so many things like that available. But, not just putting up with it forever. And as we get older, things don't get better. Usually those things continue to get worse. So if we don't address it now, then it's going to get worse. So,
yeah. Well, and I feel like that it's one of those things that, 100% of women, I feel like, and if you would be honest about it, if you take estrogen away from the pelvic floor, which 100% of women are going to after they go through menopause, we have no estrogen, then there's just inevitable changes there. You can't help it. So it's not, it may matter, like if you're a little more active and you go to the gym and you lift weights, will you have stronger muscles and fascia? Probably, but like your vaginal tissue is going to thin and atrophy, and you cannot help that. You can with vaginal estrogen, and there are things you can do. But I think most people may assume that like pelvic floor dysfunction or prolapse or those kinds of things like have to have a surgery, or like I don't want to go see, because I hear that from patients, I don't want to go see the urogynecologist because I don't want surgery.
Right.
And
there's so many other options. Because we had 3 nurse practitioners in our practice, so we took care of women that didn't want surgery.
Right.
So I think there's lots of options before we get to that point if you don't want surgery.
Yeah. How much like sexual health did y'all do?
I did quite a lot, again, because I was doing the hormones. So I feel like all of us, as far as pain, most women deal with pain. And so I would say, the vast majority of everyone wants to talk about that, just because even, no matter how old you get, that is an issue if you have a partner. I feel like
probably more trying to like start to you, like, being more open and honest to you about things, because y'all are talking about like all things in the pelvis.
Leakage, because I feel like, things that they're embarrassed to talk about with anyone else, they would talk about with us.
Yeah.
Which we would ask all of the very deep questions as far as like, leakage of urine when you're having sex is, I feel like for most women can be kind of embarrassing. So they would, but we ask about it. So then they're like, oh, maybe that's not normal. And it can be treated. I don't have to just not have sex ever again.
Right.
So I would say pretty much, I would say 90% of our patients, we would at least talk about it. And, especially if they had a partner.
Yeah. And so a lot of Amy's patients have followed her here, which is awesome.
Yeah.
And so I know getting through a new system is hard for everybody. I mean, we've all struggled getting used to new electronic charting. So I hope that you're adapting to that. And so for patients are having to sign up for new charts and
they're working it out.
Stuff. Yeah. Well, so why do you think that women wait so long before they go? They just don't know it's available, or?
I think so. I feel like that a lot of our patients, they didn't even know urogynecology was such a thing,
Yeah.
And again, because they've maybe been told so often that that's just part of aging, or you just have to deal with it, or their grandma dealt with it. So here we are, they took care of a family member that had these problems. So they knew it was an issue, and they maybe didn't realize there was anything you could do about it. But now we're becoming more well-known and friends are talking about it. Word of mouth is probably the biggest thing, is that when women talk about it, then they know, okay, this is something that there is something I can do about it. I don't just have to live with it.
What are some of those non-surgical options, whether that's pain, leakage, whatever?
So like I said, the pelvic floor physical therapy is a good one. There's pessary devices that can help with leakage. There are some kind of and lesser invasive procedures like Botox injections into the bladder, or they do urethral bulking injections. So those things can kind of be, they're outpatient, or sometimes can be done in the office. Treating the vaginal atrophy with estrogen actually can help a lot with leakage. So I'd say that's a big one. For pain, we did a lot of vaginally placed pain relievers. So like vaginal Valium, baclofen, there's compounded things that have lidocaine, or I feel like there's definitely a patient that she's, I don't want to toot my own horn, but, she's like, you changed my life. I can't believe I went through so much. And then it's the vaginal Valium that my quality of life is back.
That's fun.
So,
so good.
Things that sometimes the pharmacies will call, because cost is a huge concern for most of us. So the compounded suppositories can be really expensive. So I have a few people that use an oral tablet that we place vaginally, and the pharmacies can be a little confused by that. But I usually just let them know, yep, that's what we're doing.
Yeah.
So
I feel like you were using vaginal estrogen on your patients way before the DSM guidelines came out.
For sure.
You've been doing that for a long time.
Yes.
Yeah.
That's
so good.
So.
Did y'all use a lot of testosterone too, or?
I feel like, there's some guidelines through the American Urogynecologic Society that say if we can get their testosterone above 25, that you'll have improvement in libido. So I feel like we've been doing it for several years, just because that came out at one of our meetings several years ago. So we used a lot of topical compounded estrogen. Testosterone. So to kind of gradually get those levels up. And then as I kind of went through this learning process through the Menopause Society, I'm like, oh, there's a lot of other ways, and getting that level up even higher to help with your muscle mass and your energy level. Libido is not the only thing that testosterone addresses. So then, again, sometimes compounded injectables or trying to dose testosterone for a female can be a little complicated.
Yes.
And cost is probably our biggest thing too, and insurance doesn't cover it. So I've kind of been, I'm so glad to be here, because I feel like I was kind of out there trying to maneuver some of that myself, and just reading as much as I could. And so now I'm like, oh, I have another group that can kind of help me come up with more ideas.
You're
That's great.
Yeah. I feel like we can just all help each other learn more up here. You can bring in the Urogyne, we can bring our hormone stuff. But and I think we've talked about this a couple of times on here, so I don't know if anybody is listening or even physically comes here or cares, but we are going to be moving down to the 11th floor. So we are all crammed in, me, Courtney, and Amy, in my office right now. And so there's one office and then 2 exam rooms, technically, that we all 3 share, which, as you can imagine, is not super great trying to like all fit everybody in there. We're making it work, and there's usually another doctor that's out doing surgery or out on call or something. So we'll just kind of wander around and find other exam rooms. And sometimes you come in the podcast hearing. I mean,
Yes, this will be recording anything today.
Yeah.
Here.
I mean, it's been a little wild, but we are going to get an actual dedicated space that we are all going to have our own offices and exam rooms and things like that. So,
And it's still the women's clinic. I've had patients ask, "Oh my gosh!" I'm like, "No. It's all still the women's clinic.
Yeah.
We're just expanding. We're just down to the 11th floor, and I feel like it's going to be like Hormone World down there. I mean, it's going to be. I'm so excited about it.
Yeah.
So great.
I think it's going to be so fun. And then, I think it'll be like our own little dedicated space down there. And then I really want to, in the future, kind of open up to like telemed for, people in rural Arkansas. Or, I mean, we would only legally be able to telemed people in Arkansas. Because as far as I know, we all only have an Arkansas state medical license.
Yeah.
But you have to have a medical license in the state that you're doing telemed if that patient like lives in Texas. The patient can be in Texas but live in Arkansas, and you could do telemed on them, but they have to live in the state permanently that you're doing telemed in. So I want to open our practice to things like that. And so having Amy and having more people and having a more functional, dedicated space is going to help us do stuff like that. And I'm excited about just the opportunities of things that are to come, because I feel like we are one of the only clinics, I mean, in Little Rock, but in the state really, that has a dedicated, like, we treat hormones and we treat menopause. I mean, I feel like probably any gynecologist can talk to you about that, or any urogyn can talk to you about that, but that's not like the focus of their practice. And so they're not going to probably have that carved out time and people who sit around and read and think about it all the time and want to do that. So I'm so excited about having all the menopause certified people here and just kind of
being able to take care of all these women that need us. For sure.
I know. And so we're going to do, well, I don't know. Is there anything else like you want to tell us before we?
I don't know. Y'all ask great questions. So I think I've answered them.
Okay. So we're going to do some like rapid fire. I thought this would be fun. Just kind of, I don't know, get to know you sort of things. And I mean, some of these things I don't know either. Like, do you prefer coffee or tea?
Coffee.
Okay.
Really a Coca-Cola, but coffee in the morning.
Yeah.
Coke with lunch.
Coke with
I
lunch,
learned
for
that.
sure.
Yes.
Like a real Coke?
A real Coke.
Wow. Okay.
Yeah. Mm-hmm.
Yeah.
Definitely not good for me. So,
well, I mean, no judgment here. I mean, we've all got to have a thing that gets us through the day. I mean, I drink an Alani every afternoon. That's probably not good for me. So, but it gets me through the
everybody has to have a
afternoon.
flaw, or if we're too perfect, no one will like us. So.
That's right. Caffeine is definitely my thing.
Yeah.
In any way that I can get it.
I think we were talking about this one the other day. Morning person or night owl?
Night owl for sure.
Yes.
Yeah.
Me
I feel like people
too.
will get phone notes from me from 1 a.m. Just
Not Courtney.
Yeah.
Do not.
No, I'm going to bed at 8 o'clock.
I know.
I turn that phone on silent, and I'll get a text from you at like 10, and like I'll text you back at 5:45 in the morning.
I know.
I'll be asleep at 5:40, but I'll be up until too sometimes.
Oh yeah. When we first started working together, I mean, I would text her at 9:30, 10 o'clock at night, not even like expecting a response, but mostly just like a brain dump, of like, I don't want to forget to tell you this. And then, the next morning it would be,
Hey, I was already asleep last night.
already asleep.
Look, I have 3 feral children, and as soon as their little heads hit that pillow, mine is too.
Yeah. Yeah.
I have a 21-year-old and an 18-year-old that are up late. So sometimes I may take a little nap, but then if she wants to FaceTime me at 11 or 12, I'm like, I want to be there.
Now, my life will probably change drastically whenever I have kids that drive and all that stuff. But for now, we're sleeping in the Span household.
For sure.
As much as we can.
Yes.
What is your favorite healthy snack?
As we just talk about how not healthy.
What is your favorite
I have a
snack?
friend that she just makes fun of me because I'll say things that are healthy. It's like popcorn because it has fiber in it.
It's corn.
I like raspberries with chocolate. There's not a thing that I like that's healthy that doesn't also come with something.
Yeah.
All natural peanut butter.
There you go.
There you go.
So
I like that.
just with a spoon. So
Yeah.
Yes.
I love it.
Yeah.
I just
Perfect.
ordered this weekend. I decided I was going to start eating avocado toast for
I love
breakfast.
Love.
So
that's really
I
good.
ordered it. My grocery delivery should be in today. So
Sourdough bread is really good too. In case you.
Oh, yeah. I
So
want
I
to
feel
bread
like-
sourdough.
Mm-hmm.
yeah, it'll be better than my like granola bar that I eat.
Yeah.
It's like some protein bar, and then you're like feel like you ate
You'll be more
cardboard
satisfied.
for breakfast. So
Yeah. I'm
just-
kind of hung up on this roasted edamame. They come in like little individual snack packs.
Yeah.
So they're good to just like throw in your lunchbox. And they're like 14 grams of protein.
That's nice.
yes,
I mean, I feel like I'm just eating so healthy by eating those.
I don't, Amy, you have not met my dad. I'm sure you will, but Courtney's met my dad. And he was over at my house last night schooling me. He's not a doctor or anything like that, but he was schooling me on how to figure out how protein dense a food is. And then we were going through the pantry and the refrigerator looking, and like you take the calories, like if something's 200 calories, you drop that last digit, so 20, and then you look at the protein, and if it has like 7 grams of protein, then that you do a ratio like 20 to 7.
Yeah.
And so you want that ratio to be as close to 1,
Mhm.
like 1 to 1 as you could get it. So
Good job, Amy.
we were going through all the things. My kids thought it was so fun, but
Yeah. I like
like
there's
a-
so many foods that are not very protein rich.
and when you start looking at it like that, you're like, yeah. And then, George was looking at his like Captain Crunch all berries. I'm like, that's like a 20 to 1 ratio. So ridiculous. Yeah. Okay. What has been your favorite vacation you've ever been on?
Oh gosh. Well, Jamaica probably is one of my favorites. We went there on our honeymoon and then went back on one of our anniversaries, and then we took our children once. So we always call that like a once in a lifetime vacation that we've been on 3 times.
Do you get my same?
30. Well, no, different places.
Different
Well, I guess the first 2 times we did go to the same place in Negril where we went. That's adults only.
Okay.
So then we had to go back with.
Was it
friendly
Sandals?
place? No, it was the place where Stella got her groove back, but now I can't remember the name of it. But it was in the movie.
That's so funny.
Yeah.
So
I have not been there, but it's beautiful on the list.
Yeah. We went, but not to Negril. We went to like Dunes River or something. I can't remember. But Negril did look so pretty, and it's got that famous 7 Mile Beach or whatever it's called. But
It's beautiful. The
I know.
ocean's so clear and
I love it. Wonder what kind of hormone care they're getting down in Jamaica.
probably not much. I would not imagine.
I mean, that's our next
Oh,
venture.
yes.
First, we're going to try telemed in Arkansas.
And then we'll branch out to the Caribbean. Go straight there.
I mean, I don't know what the telemed laws look like outside of the U.S.
Yeah.
It's probably more lenient.
For sure.
I would imagine.
Yeah.
Yeah. I mean, we were in Turks and Caicos last month, and like they don't even pay taxes.
Yeah.
I mean, I think it's a whole different
I could see
situation
myself
there.
bringing a suitcase of vaginal estrogen to
Yes. Let's do it.
yeah, go on like a hormone mission trip. Usually mission trips are like things that are, going to be life changing and save your life. And then I'm like, here I come with my estrogen
hormones for sure.
Let's go.
Sounds great.
I love it.
Tag me on our next business trip.
That's right. That's right. Okay, the biggest hormone myth.
Yeah, I think the hormones cause cancer. It's probably mine.
Yeah,
the biggest one.
Yeah. And then the most underrated menopause symptom, like the one that people are like, it's no big deal.
Gosh, well, that's a tough one. I feel like maybe the leakage, because kind of we talked about that. That's just part of aging. But and they don't realize how much your hormones come into play with your incontinence.
Yeah, or they just don't maybe realize that the two are connected. Like I feel like people like that with like joint pain or weird stuff that they're like, oh, I had no idea. I've been to 5 other people about this. I had no idea it could have been my hormones all along.
And the weight changes too.
Yeah.
Oh, my clothes don't fit the same.
Oh man. Yeah.
I see all the time like somebody's, having heart palpitations or their cholesterol has been steadily going up over the last few years. And they're like, I don't know what that's about. I'm like, I do. Let me help you through that.
Yes.
Just connecting the dots to all the things.
Do you have wellness habits?
I mean, I would say like a daily thing or just
I take my, I think I'm doing good when I remember to take my fiber and my multivitamin in the middle of the day. I'm like, Look at me being so healthy.
Yes.
Yeah.
I mean, I would say I take my hormones every day.
Yeah.
For sure.
Yeah. I did remember to change my patch was supposed to be changed on Sunday. I remembered to do that this morning. It's Monday.
Yeah.
So, the struggle is
the best we can.
I know. I'm always about a day behind.
Yeah.
I take my progesterone every night.
Yeah.
Drink my electrolytes every morning.
Yeah, she's been drinking those. I mean, Courtney probably has the best electrolytes of anybody because you've been drinking electrolytes as long as I've known you. Sleeping. I mean, you're probably just incredibly healthy.
I mean, I'm trying.
You're going to be I'm going to try to be better about my healthy.
I need to work out. I do not work out very much.
I'm going to go today. I have my trainer.
Okay, good.
I'm going to go today.
Good. I need to get on that.
It's not fun, but it's necessary.
Yeah, it's necessary.
Okay. If every woman listening today could hear one piece of advice from you, what would it be?
I would say just don't ignore your body and come and talk to us about what you're feeling.
That's right.
Love it.
Yeah. And if you don't know, or you think it's like, I don't know if this is associated or not. I mean, if you Google it, it's probably going to tell you that it is because the list is like a mile long of things that could be associated, but just come and check it out. So we are so excited for y'all to get to know Amy. She brings a compassionate approach to patient care. She, like I said, already has a good patient following, and we know that y'all are going to love working with her. She's got already this kind of baseline hormone knowledge, certified, and all the things. So whether you're coming in for hormone therapy, she does routine annual exams, just routine women's health care, or concerns like pelvic floor dysfunction. We're excited to continue growing our team so that we can help even more people. So if you enjoyed today's episode, be sure to follow us on social media. Leave us a review. I don't really have any idea how you do that. Maybe on Apple or Spotify or something.
I think so.
We don't know. Just say something nice. Don't be mean. And send this episode to somebody who is looking for a provider and maybe wants to get to know Amy. So, and then if you have any questions or any suggestions for future episodes, we would love to hear from you. And do stuff for you, from you, for you. But join us next week. We have lots of fun topics ahead. I just have kept this word. Look at all these things that I've I just have been, have all of these. And as I'll think of something, I'll just start a new Word document. So one that I'm excited about is like things I wish every woman knew before 40, because I'm 45 and I'm like, damn, I wish I would have been started on whatever I'm doing right now, 10 years ago and not like right now. Because sometimes once you get to the moment, it's you're doing lots of backtracking. So that's one that I'm excited about. And then we've got lots of like, what's the deal with estrogen patches? Why do we have a shortage? Why is everybody on a patch and not a pill? We've got those kinds of episodes. And then like some bone stuff. We got lots of stuff coming up. And then in September, we've got a doctor from California coming on to join us. And she's from Jamaica, actually.
Oh, yeah.
Yeah.
She's cool. She's a cool lady.
Yeah. She's from Jamaica.
She knows where to go for
For sure.
Yeah, that's right. She can tell us about maybe hormone care in Jamaica, but she lives and practices here in California now. So we're excited about just all the things coming down the pipeline of Hump Day Hormones. So stay tuned. Come see us when we get our new space, maybe in about 6 weeks.
Hopefully sooner. But yes.
All right. Have a great week. Bye.
Bye.